Do you really think the skincare industry in itself is feeding on the insecurities of women? You're absolutely beautiful. You've never thought of, dating again or being with someone else again.
If today I'm associated with someone, whether it's like a dating or a marriage, how would my child benefit or how would it impact him positively, negatively? And that always comes first in my, life. As a single mother, your child's future is very paramount that point of time. And it was very clear that I need to do something independently so tomorrow my child can run and grow and be something on himself. So LED light is what we're talking of, which has different lights. There's red light, blue light, yellow. Yes, so there's a whole spectrum of it.
There was a conversation around UV lights that are really dangerous when you get your gel nails done.
Yes.
Let's talk about that, because a lot of women today, especially in the UAE, they are getting their gel nails done, and everywhere across the world, even younger kids. How damaging is this UV light? Why do you say no to face yoga?
So while I love yoga, I recommend my patients please do yoga. But when you're looking at face yoga, there's nothing wrong except it's overhyped.
This word that you use, the retinoin, because a lot of doctors that I know in the UAE are actually recommending the retinoids. Is that really a great anti-aging treatment?
So I generally recommend botulinum toxin in 30s. That's when your lines and wrinkles are starting to set in. So I'm being preventive. When I do it early, I prevent a lot of long-term static or lines which we can't treat very easily.
Hello everyone, welcome to Real Talk on the Shanu Suresh show. I am sitting alongside Dr. Madhuri Agarwal, and you're having a very interesting chat about life, about skincare, about social media fads and whatnot. So Doctor, I stopped in the previous half talking about your life.
Yes.
I'd like to restart our conversation by hitting upon that. We've had a lot of personal hardships, and that is something that a lot of women out there can relate to. Relate to why? For multiple reasons, because of course there are a lot of single women out there, there are a lot of single mothers out there, and there are a lot of single mothers trying to build a career, if not an empire.
Right.
How are you doing it all, and what happened in your life? If you could just take us through all of it.
So I think I had an early marriage during my studies, and unfortunately it turned out to be a little abusive. And that's when, luckily with my family support, I took a stand that because of my child and myself, for my health, I need to get out of that. I think though we are all educated, we still want to believe in the good of marriage. But after a point, you realize you have to take a stand. And that's where, I decided to step out and, get away from that marriage. And I urge people, you should support your family members or girls who are struggling with this, because I do see a lot of girls who come to me and say, my family does not support me and it's difficult to get out. So I think I was lucky and fortunate. I had a great support system. My family, my parents, my brother were all with me. And that's why, I could get out of that. And I think over the years, because of my education, I said that, I can balance my career along with my kid, but definitely nothing without a support system.
It was definitely difficult
at that
point.
It is.
But what kept you going? This is one question that I usually ask a lot of the founders that I interview and a lot of corporate leaders. Of course, this is applicable to everyone. We reach a point in our life where we often have to make a choice. And that choice largely depends on the conversation we have with ourselves.
Agreed.
A lot of people can head into depression. A lot of people's, their life can deteriorate. But that talk, what did you tell yourself at that point, and your mental conversation? Tell us about that.
I think it was mainly because as a mother, as a single mother, your child's future is very paramount that point of time. And it was very clear that I need to do something independently so tomorrow my child can run and grow and be something on himself. So while I had a great support system, I didn't want to be, and I think those values were there, that work hard, be dedicated, and be independent. And I kind of said that I have that passion, I have that urge, I have that support system, and I want to be persistent enough to do this for me and my child, and to prove people that even single mothers can have it all if they have the right balance of support, passion, energies. This was 20 years ago, so it was a difficult time, not like today. Today also we will struggle, but that time it was very, I would say, looked down upon that, single mothers, building a career, how will it do? But I think fortunately, with whatever circumstances I had, the support system, I think I go back to it, and it has kind of pushed me. And yes, seeing my child's smile and that happiness, that kind of always makes me do that one extra thing for for myself also, not only him.
You're absolutely beautiful. You've never thought of, dating again or being with someone else again. Of course, there's so many reasons why you are eligible in every other aspect, and a lot of men would definitely be wooing you. Why? Why not? Was that a personal choice?
As I said, this was 20 years ago, where the perception was if you're a mother with a child, it's looked like a baggage. And, they rather have you than the baggage, and which obviously no mother would want. So I think, and always as a lady, you would think, and a mother, that if today I'm associated with someone, whether it's like a dating or a marriage, how would my child benefit, or how would it impact him positively, negatively? And that always comes first in my, life as a mother. So when it's not that I'm off it, but I now found that right person who would say, okay, you are mine, and your child is also mine. I think that's the struggle which you always look at. So I think
you think your child, or your son, actually, he's much older today, right? Yeah. You think he would be open to you coming home with
absolutely.
Yes?
Yes,
That's beautiful.
Yeah. So I think my son, fortunately, touch wood, he's grown up into a lovely man, great values, very proud mother. And he's always, that, please go ahead, date, get a partner. I want you to be happy. In fact, few years ago, he asked me, why are you not thinking of getting a partner, getting married again? So I think...
that is something that I have truly observed with our generation today, because even I lost my dad in 2013, and I have been pushing my mom, like, Mom, please go out, meet people, have fun, like, this is the time, you need to do it. She's like, what rubbish. And she's somebody who loves the confines of her house and loves, my dog and cat and all of that. But I'm like, Mom, come, I'll put you on dating apps. Let's just go meet people. Why not? Because I think it's obviously because we brought up within that Indian mindset that now it's a lot different, but again, doing that is looked down upon. But internationally, everyone's having a partner, maybe not one, maybe three, if you can juggle it all. Okay, so bring the conversation back about women. And do you really think the skincare industry in itself is feeding on the insecurities of women? Because, of course, a lot of women look at themselves in their mirror and say, I have 10,000 issues. But when you look at them, you think they're perfect. We look at ourselves with all of these issues, but do you really think the industry is milking on that fact?
I think we always, as women, had those insecurities. I remember a few years back, I had a patient who came to me and, bad skin, very depressed, very down, and said, Doc, can you do something for me? She stayed on with me. Few months down the line, her skin improved. And she came and told me that, my husband used to treat me like a doormat because of my looks. And now he's telling me, don't go to doctor, you're looking too good, you may run away with somebody.
My goodness.
So that's the kind of thought process, unfortunately, we are staying in, that yes, there is insecurity and still it has been fed on. And I agree, industry is milking on it. Why only women? They are milking on kids nowadays. That's where the kid thing has started. So I think the commercialization on the transactional behavior has reached to its peak. And we see a lot of that happening even in skincare.
Let's flip the script a bit. What is that one procedure or one skincare routine that you feel we should follow?
Skincare routine, I think.
Or a procedure or whatsoever.
I think listen to your skin, most importantly. Sit down with your skin. Understand what it is trying to say to you. Listen to your skin. Don't listen to just your favorite influencers or your favorite Instagram doctors or what your best friend is doing. Because the skin is your best friend. So I think that moment, it's like doing meditation. Sit with your skin, listen to it. And when you do that, you'll automatically get your answers. One. Secondly, sunscreen for sure. That is one product that I think everybody should be doing. I know it has been said time and again and over said, but I think you can never say it enough.
I would like to talk about this a bit more, because when I was growing up, of course, we had to use sunscreen when you were, playing sports or whatsoever, but it was never really used in
Yes.
such a mandatory fashion as
Yes,
it is today.
yes.
Today it was like you have to wear sunscreen even at home. The blue light on your phone is making you tanned and whatnot. But
Yeah.
when I was growing up, we would wear sunscreen if you're having a
Absolutely.
sports day or something. But otherwise, we never
Yeah.
really used sunscreen. What changed? And since when has sunscreen become such an important part of our lives, which was never there before?
Yeah. So one, definitely awareness, A. Secondly, the amount of sunscreen products that are available, which is a good thing. We have, a plethora of sunscreens of different kinds, which has made life easy to choose and pick. Then obviously the environmental changes, the ozone layer is shrinking.
Yes.
We have a lot of free radical damage from the environmental factors, which is very harsh. So all these things are affecting our skin. And that's why I think sunscreen becomes, and previously people would typically stay at home. There would not be much of travel, maybe go to the office. A lot of women were working at home. They were not outdoors. But now everybody's traveling. They're going to places, doing different whole lot of things besides playing sports. So I think sunscreen becomes mandatory. And again, the awareness of the blue light causing damage because the screen time has gone
Is
up.
that true?
Absolutely. So I think few years down the line, if you would ask me, I would have said, I'm not sure. But now there are a lot of studies which prove that your blue light or, the high visible light does cause, oxygen, free oxygen damage. So you see
Free
that.
oxygen radicals.
Yes,
that
damage. Then you also, the light goes deeper than a UV light and over a period of time affects your skin barrier. There's chronic inflammation and then you start seeing those pigmentary changes or aging changes coming in.
So you're saying it accelerates your
Yes,
aging
yes.
process.
It's not immediate, but over a period of time, cumulative. The more screen time, the more impact.
Being a doctor, do you really think there is a lot of pressure in looking flawless and perfect all the time?
Absolutely.
How do you deal with that?
So, few years down the line, I was just sitting and, I generally don't wear makeup. And a patient comes to see, but aapko bhi to dark circles hai. I'm like, okay. So people do watch you. If you're in the skin industry, they expect you to be flawless and perfect. But I'm okay. Like I have a scar. I tell my patients, you have to be unique. That is your uniqueness. You can't be completely like a robot. Everybody looks the same.
Cut, copy, paste is something.
So you're
that's-
erasing the identity, right?
Yeah.
And rather than enhancing. So somewhere I do my bit and educate my patients and learn to love yourself, accept it. I don't know how much people listen.
Yeah, we keep listening to that all the time, and ultimately, who follows it? Nobody. A lot of people are advocating a lot of stuff on the internet, saying follow this, follow that. A lot of younger women are watching this content.
Yes.
Please tell me a cautionary or a word of advice for everyone watching this episode, not to follow stuff from people, because let's talk, I'm an influencer myself or content creator. Let's not use the word influencer because it's looked down upon, but every content creator in the skin category or beauty category has a lot of advice, and all of them come across as experts because of the research and all of that they have done. But being a doctor, how do you look at that, and what do you have to tell our audience about that?
One, it is a good thing because the awareness has grown. People are more aware that what they want to do for themselves, what is available for them. And sometimes it makes life easier as a doctor for me that today if I talk of a procedure, they've done their homework. So I don't have to spend a lot of time educating them, or at least, we are having a frank conversation and they're open to it. But at the same time, when you're looking at, everybody's, as you said, a content creator about skin and hair and God knows what. So I think when you're looking at them, first look at the credentials, very important, there are a lot of these quacks, we call them, or unqualified doctors or unqualified, dermatologists. So look at the degrees, are they registered with the medical body? That state or the country's they have the registration number, they put their degrees on properly. There are a lot of verification portfolios which are there, or platforms which you can go and check. Also, when you're looking at a content creator, I'm not saying they're wrong. They have done their research, but at the same time, we spent 8 years studying just skin and hair. That amounts to something. So I think you need to look at qualification, credentials, take it with a pinch of salt, and also, as I said, sit with your skin and understand, does this apply to me? So don't be very blindfolded or, just go ahead and follow things. Do your homework also about that person before you get into it.
Fair. I want to understand a bit about the business side of things now. Of course, running a clinic, and you have two clinics, right? So how does the skincare industry really work? Because not just in the UAE, across the world, we have a lot of competition.
Yes.
How are you staying relevant, and how are you able to stand out? Of course, the word of mouth spread, and
Yes.
your work speaks for itself. But as a business, how do you scale, and how can someone be where you are today?
I don't know if the right person to comment on business because I work with a lot of passion than commercials for my clinic and my patients.
I can vouch for that.
So for me, it is. I think as a business owner, doctors are always entrepreneurs. If you see right from older days, they would run a clinic. They would be the HR. They would be the purchase manager. They would be talking about getting whatever medications, telling your patients what to do, taking care of the fallouts, do the legal thing, everything. So I think it's ingrained over the years that we start practicing it. But I think few things are important as a business owner. One, you have to be very realistic. I don't look at what others are doing, let me tell you. I look at what I am doing and what I want to do next. I think focus on your own growth, on not what others are doing. That's very important because you sometimes get carried. I get juniors saying, ma'am, but he has got so many machines, or she's got so many this thing and marketing and all. I said, yeah, but is it doable for you? So you have to know your limits also. You should know what are your budgets. You should know what can you do, what you cannot do. Have a plan, have a 5-year plan on what you want to do next 5 years. Have an amazing team. So when I say team, you have to be there with the team. You have to grow that team. So if you have a stable team, they take care of a lot of things. Like when I'm here today, they are taking care of my clinic. So I think a credit to that, that your team should be good. You should have a sorted business plan. You should stay in your limits. I don't like to work with partners and investors. I like to do my thing, but there's nothing wrong. If you have somebody sensible, I think that helps. And also give time to yourself. Others will burn out.
Right.
So take breaks in between. Feed your own energies, your positivity, your passions. Otherwise, in the long run, you will feel, what am I doing? And it's like a machine work.
What is the biggest lesson that you've sort of learned in the past 20 years, in scaling up your clinic? This is a business-related lesson that you've had.
I think take help. You don't know it all. And there's no shame in asking for help. I never hesitate that if I ask help, they will feel, I don't know anything. So for me, that important thing is, have a lifeline of people, whether it's your team, your family, your friends. That's very crucial, and ask for help. Ask your colleagues, your juniors, your seniors, wherever you get help, because at the end it's going to benefit you. So I think that's very important. I've learned along the way, which very few people like to follow, I feel.
Doctor, my nails and many others like me enjoy getting our gel nails, enjoy having nails on point and always being exquisite in that department. Then there was a conversation around UV lights that are really dangerous when you get your gel nails done. Let's talk about that, because a lot of women today, especially in the UAE, they are getting their gel nails done, and everywhere across the world, even younger kids. How damaging is this UV light?
So I think along with UV light, it's also the gel polish or the nail art people are doing, or the extensions people are doing. So
yeah, okay, I'm going to hide them from you. But please.
Yeah, I'm watching. So I think they contain a lot of chemicals like acrylates and all, which damage. Nail is again, dead tissue with the bed at the end. Now, if you put a lot of pressure on the bed, it's going to die. And then, obviously anything is dead is not going to grow well. So I think that part of it. And UV light, you can definitely wear gloves and all that. But for me, the content of a gel or a nail art itself is more toxic for me as a doctor than, as just a UV light alone. So it's a accumulation of all these things. So I'm not saying don't do gels, but give breaks. Don't be, continuously doing it. Give, breaks in between. If possible, do it only for occasions. Go for regular paints in between. So all those things, and nail care, cuticle care, moisturizing, and also supplementation, all those things help.
While we are busting myths and fads, we talk about UV lights, and there is this huge hoo-ha going on about the UV lights for your face, and there are people inserting their entire bodies into UV pods. It's insane. I mean, coming from where we were back in the day to where we are at the moment, and God knows where we're heading. Is the red light on your face really helpful?
So LED light is what we're talking of, which has different lights. There's red light, blue light, yellow. Yes, so there's a whole spectrum of it. Yes, there are studies which show, like we use it in our clinic for our medifacials. So red light is known for calming the skin. Blue light we use for acne purposes. Green and yellow is for pigment. So it has its functionality, provided it's the right power and the equipment is right. Unfortunately, there is a lot of, again, when we look at these things, people bank on it that if I do LED light, my skin will become flawless. How?
Yeah, and is it really
No,
anti-aging?
no. It is a supportive thing, right? You can't expect it to do everything on its own.
So what does it really do? Because you said there are red, yellow, blue, green.
I gave you the colors of rainbow.
Plot right there. No, but what is each light or each purpose of each light different?
Yes, they are different and they do help and support the treatment. But they are not the treatment, you have to remember.
That supports your treatment, but that's not, because a lot of women I know, they use the UV
Yes.
masks before bed
Yes.
after applying their moisturizer or something.
Yes.
Is that the right way to go about things?
So I honestly don't know what is the right way, because these are all self educated or self claimed procedures people are doing. Generally, we use LED lights after treatments or in between treatments to calm down the skin as a protocol for 5 minutes. What they're doing is not wrong, but I don't know how far is it going to help them. Because if you don't use, I have seen burns with LED lights, because if you don't have the right power and you're putting it on, it can harm your skin too. So nothing is, in excess is too good.
Right. What about each color? What does each color do?
Red light helps with inflammation, and some people claim anti-aging benefits with it, and that's why you see that whole hoo-ha about LED red light.
Yes.
Yes. Then your blue helps in acne. It helps to kill the P. acnes, the bacteria causing acne, and then your green is supposed to help in pigmentation. So these are some, but they're very sporadic studies. I wouldn't bank on them. Use it for a fun thing, why not? But
For fun, okay. I like that. See, as long as we're using something for fun,
absolutely.
not expecting
I'm
a
all
miracle.
for it. Yeah.
Right?
Yeah.
Because, talking about miracles right now, the miracle drug, Ozempic.
Yes.
What was the other one? Mounjaro.
Mounjaro. And then now
there's
we have
one more.
Wegovy.
Yes. Okay, this is insane, because we see a lot of celebrities who are endorsing left, right, and center. Of course, it's a diabetic drug,
Yes.
which as a side
Yes.
effect, you lose weight. It reduces your appetite. And the issue is, we don't know the side effects of it. We don't know the long-term
Absolutely.
implication. And we also see a lot of people aging with their facial fats just like, sucked in completely. It just looks so wrong. So talk about these weight loss drugs or the miracle weight loss drugs. What's your opinion on that?
I think it just started as a side effect thing. When they started using it for diabetes, they realized this gives a lot of weight loss. But you have to understand, when we are saying weight loss, it's not just like body weight loss, it's muscle wasting, it's volume loss, which is not healthy. People are going for it, and I don't think anything wrong in that, because as we talked about PCOS and obesity and diabetes, these are growing health metabolic disorders which are happening. But when you're using this, don't use it as a weight loss drug. Like I yesterday got a mail from some random person saying, I don't have diabetes, but can I use this? Will you prescribe it? I don't stay here. And I'm like, is it like popping, chocolates? Yeah, this is a serious drug with its side effect. You have to look at what are the studies which are there. How does it impact your liver, heart, kidney in the long run? And ideally, if you're doing this, you should do it under the supervision of a medical professional like a physician or an endocrinologist who know what is the long-term impact. So please don't go in the habit of just going to any random person saying inject me or give me the pills for it.
I've seen my friends, they were in their 100 kgs and they have dropped 30 kilos.
Yes.
Is there a side effect?
There are side effects in terms, if you're doing it under medical supervision, not really. In our clinics also, with the help of we have a physician attached to us, so we do give it to our patients. But we do all the blood tests. We brief our patients on the possible potential long-term effects of it, and you have to take it for a few years for it to be really effective. So
For a few years?
Yes.
So you're never really off the drug?
No, because it's, you're taking a drug, it's giving the effect. You take away the drug, the effect will go away, right? So that's why it's proper, it needs to be understood, it's not a quick fix thing.
One last question before we head straight to rapid fire. What is a word of caution or a word of advice that you would like to give 15-year-old girls who are starting their skincare routine this early in age? And if not for that, what should they really do, and what is okay for young girls today?
I think it's important to not get swayed by what's there online, because we are looking at 30 years old, 40 years old talking about these things, or maybe 20 years old, and you're just 13, 14, 15. So there's a huge difference in your skin morphology, the biology, the way your skin is going to evolve with hormonal changes. So when you're in doubt, always consult a board certified dermatologist, I would say, because they'll guide you on what are the do's and don'ts. If you're not sure, just stick to basic routine of a cleanser, moisturizer, sunscreen. And yes, if you have issues like acne and all, then consult a proper doctor, a dermatologist who can tell you what has to be used. Don't use like things like oral isotretinoin and all by yourself, because it is a powerful drug. Like I come back, you won't treat your heart or your kidney or maybe your bone by yourself. Then why are you treating your skin by yourself?
This word that you use, the tretinoin, because a lot of doctors that I know in the UAE are actually recommending the
Yes.
retinoids. Is that
Yes.
really a great anti-aging treatment?
So oral isotretinoin, we use it mainly largely FDA approved for acne patients.
Okay.
Retinoids or retinols, yes, when you apply them, not take it orally, is great for anti-aging. So they're two different things.
Okay, fair. All right, doctor. I know there is so much to discuss on the topic, but unfortunately we are pressed on time. So let's head straight to the
Okay.
second rapid fire. All right. So I'm going to pull out my second rapid fire. So basically this is, it's this or that.
Okay.
Your expert opinion on what you prefer, right?
Myself.
Yes. What do you
Okay.
prefer as an expert, your expert opinion on the field?
Yeah.
Okay, so 3, 2, 1, and Botox or filler?
Botox.
Okay, tick tick. Chemical peel or laser facial?
Laser facials.
Oh, I want to know why. Hyaluronic acid or niacinamide? we know.
Niacinamide.
Okay, face yoga or PRP?
PRP any day.
Okay, she doesn't believe in yoga, no guasha. Okay,
Face yoga, no.
okay. Oh, there's so much going on about it. We'll talk about that. So, tinted sunscreens or spray sunscreen?
Tinted sunscreen for sure.
Okay. Graceful aging or age proofing?
I would want both.
No, you don't pick one.
Both.
Oh, okay.
One is my choice.
LED lights or gua sha?
LED light any day better than Gosha.
Really?
Choosing the lesser devil.
Oh, okay. All right. So I didn't add many more questions on this, but I definitely want to know, why do you say no to face yoga?
So while I love yoga, I recommend my patients please do yoga. But when you're looking at face yoga, there's nothing wrong except it's overhyped. When you're doing face yoga, you're overdoing, you're using your muscles and all. So you're causing more contractions. You're heading towards wrinkles and lines and aging, And at the same time, when you're using a lot of yoga and sometimes you involve tools in that, you're causing damage to your skin. As a doctor, I will always look at scientific studies backing the claims. If I don't see those studies somewhere and I don't see those benefits, in fact, I see negative results, I would not be, vouching for it.
I really have this question that I need to ask you before we wind up. Of course, you said that we can try Botox or steroids. I mean, not steroids, Botox or fillers for that matter. And there's nothing wrong with it. At what age can you start? And how can you avoid having that plumped up face or that really awkward looking Botox face that you see a lot of celebrities that they end up having? How can you not overdo it and have it done in a nice way?
I think botulinum toxin, Botox is the brand name, botulinum toxin is, a wonderful tool for us or a procedure for us if it is used rightly by the right hands in the right manner. So I generally recommend botulinum toxin in 30s. That's when your lines and wrinkles are starting to set in. So I'm being preventive. When I do it early, I prevent a lot of long-term static or lines which we can't treat very easily. So I like to do it in the 30s A. Secondly, you have to understand how your muscles are behaving. Every muscle is different. So you cannot do the same dose for everybody. So it's like an art, it's like a painter doing an artwork. So I like to see the precise thing. Secondly, you can't overdo things. I have patients who say that I saw the frozen look. Yes, because that injector overdid it. If I do a little normal natural toxin, it would look absolutely fine and natural. I yesterday had a message from one of my patients. She's like, not even my husband came to know that I have done the botulinum toxin, doc. So I think that's where we want to look at. So the right injector, certified person, right product, and right knowledge.
It's okay?
Yes, absolutely.
That over serums?
Yes.
Okay, fair enough. Anyway, this has been an exciting, engaging conversation. Thank you so much for doing this for us, Doctor. And of course, all of you watching this, please shoot any more questions that you have in the comments, and I will make sure that we get a bit of Doctor's time and probably try answering all of those, because unfortunately we are pressed on time here.
Yeah.
Thank you so much for
Thank
being
you
with
so
us
much.
on Real Talk on the Shanu Suresh Show. Doctor, do you have any closing notes or any closing word of advice to our audience watching this?
First of all, thank you so much, Shanu, for doing this. I think this is the need of time. I think you're bringing relevant people and talking about relevant issues in the right manner. So I think please continue watching Shanu's show to know more this thing. And I think be skin smart and skin safe. Don't overdo things. Listen to your skin, as I always say. And most importantly, consult a dermatologist when you are in doubt, because they will guide you right.
Perfect. Thank you so much. And thanks to everyone watching. Don't forget to like, share, and subscribe. Bye-bye.